H3N2 is a influenza virus. Influenza, as you know, which existed even far before Corona came in our country. Not a few years, for last many decades, we are seeing the influenza. Is a variant of this influenza, new virus, which is quite an infectious virus. Infectious means it spreads very fast, and its symptoms are very acute symptoms. Patient is immediately disabled. Patient gets a lot of headache, body pains, etc. etc. But till now, what we have seen, it is not a killing virus, much killing virus. It usually is controlled within 5 to 7 days of the treatment. As already told, that this comes suddenly. Patient will start having very heavy body pains, severe headache, cold, throat pain, bronchitic cough. It's at times some GI symptoms also are coming. Patients are reporting with some gastroenteritis symptoms, for example, like loose motions or vomitings also. And usually it takes a very shorter course of 5 to 6 to 7 days. Only the patients who are under 5 years of age and people who are 60, 70 plus, or people who have some other comorbidities like uncontrolled hypertension, uncontrolled diabetes, some chronic liver disease, chronic lung disease, chronic kidney disease, all these patients should be taken care nicely, because these people have very little reserve, so they tend to worsen immediately. Particularly patients of already of asthma or COPD, if they get such symptoms of H3N2, they worsen very, very fast, and it can be life-threatening also. So such patients should be provided immediate help. Already said, after the finishing of Corona or lessening of Corona, we became again a free society. The precautions of Corona appropriate behavior, including using of masks, including safe social distancing, including hand sanitization, and not joining the crowds and not making crowds. These things should be followed again. How will they help? They'll help you protect from Corona also. They'll help you protect from even this influenza H3N2. And the last point, it will protect you from the bad effects of the polluted air which is existing, the air quality index which is almost 3 to 400. So if we use a mask, we get protected from all the things. H3N2 is a viral disease, and including Corona and the previously existing flus or influenzas, they do not require any treatment. They require only symptomatic treatment, which may include paracetamol, antihistaminics like decongestants, and if worse coming to us, antibiotic. So here a word of caution, antibiotics should be used only and only if the patient's blood counts has been done and it shows severe bacterial growth. Otherwise, as the trend is in India, people come to the doctor after having taken an antibiotic, which is a very, very wrong trend. So indiscriminate use of antibiotics must be stopped. Otherwise, most virals most influenzas of H3N2 types, they recover of their own. Antibiotics should not be used very loosely and should be used only when the doctor thinks patient should get it. This virus, let me say again, this virus will not be called a very threatening virus. The studies are as yet incomplete. We have to have more data, but till now, except for the patients who have concomitant comorbidity, that means patient having some other serious disease alongside, there is nothing to fear from this virus. This will, I believe, within less than 2 to 3 weeks time,